go get your coffee and join me with Dr. Reeves when we come back. Get your coffee and we'll be right back with GHC Coffee Break.
For these, you drive buzzed. It could be one very expensive ride.
First, you gotta make bail. Then pay me to get your car back.
Your insurance premiums will go through the roof.
And my legal fees just keep adding up. All told, it could end up costing you $10,000.
Nothing kills a buzz like getting pulled over for buzz driving, because buzz driving is drunk driving.
Welcome back to GHC Coffee Break. I'm really excited about my guest. I haven't actually had him on in a while. I told him he's running around being too busy, Dr. Reeves.
Good morning. Good morning.
Good morning. Good morning.
I think I need a cup of coffee too.
I know. I said I wish instead of having just a fake cup of coffee.
No, what is this?
Yeah.
I've got a coffee machine. We'll go get some.
Okay, there we go. See, y'all know our secret now. I don't really have coffee in my cup. I actually do sometimes. But Dr. Reeves, it is so good to have you back. You bring joy. It make me smile every time you come in.
Boy, I tell you, if you can say that you go to the doctor and you bring him joy. I mean, gee whiz, that's the highest compliment I can think of.
Well, it's true because it seems like every time I have you on, I just feel great all over. So thank you.
Well, I'm glad to hear that.
Well, let's kind of talk about something in May, an awareness month, is Lyme disease.
You know, each month is several different kind of awareness things.
Right.
But, May is a Lyme disease awareness month. And you may say, well, now Lyme disease, I remember that from a few years ago when it got a lot of publicity. I think it was on 60 Minutes and all that kind of thing.
Yeah, I remember seeing the show.
Yeah.
My mother did too, which was a bad thing.
Well, and most people thought, well, that's isolated in the Northeast and we don't really have to worry about it around here. We have had cases of Lyme disease in Georgia. And it's something we need to think about, but it's not something to get all that alarmed about at this point.
Let's just talk about what it is.
Okay.
Because that's one of those things that, maybe people heard about it a few years ago, but I don't know that everybody really truly understands it.
Lyme disease is an infection. What happens is you get bitten by a particular type of tick. That tick is the deer tick, most commonly known. Otherwise, it's called a black-legged tick. It's a very small tick. If you look at the sizes, of course, it grows bigger as it gets older, like most of us. But
Won't go there.
Even at its biggest size, it's very small. When you see remember when you were a kid and you pull a tick off a dog? Nowadays they get all this treatment and I don't really get ticks that much.
Yeah, but
those
the little
are
fat
big ticks, That is not a deer tick.
Oh, okay.
That is not a deer tick.
They're just gross.
Yeah. But a deer tick is very, very tiny. And when it does bite someone, if it is infected, then it can infect the person it bites. And so it's a particular bacterium called Borrelia burgdorferi. And
you said that, not me.
Well, probably said it wrong, but anyway, this Borrelia gets into the bloodstream of the person that it gets infected with, and it can cause a lot of different things. It can cause, first off, you get sort of this overall, I feel like I'm coming down with something feeling, fatigue, and sort of muscle achy, painy kind of thing. But what we normally look at in terms of trying to diagnose this, you see where the tick was. So first there has to be exposure to a tick, okay? Then after that, where the tick had bitten you, there is an advancing ring around that particular bite site. And then, of course, then you have all these symptoms. And there is a blood test that can be done to see if someone is infected with it. But 9 times out of 10, what you can do is your doctor can just simply say, all right, you were in an area where deer ticks are known to be, and you pulled a tick off of yourself. You know that you were bitten by a tick. You now have this circular sort of ring lesion around it, you probably have Lyme disease from all of that. And you add in the symptoms of fatigue and fever, a little low grade, that sort of thing. And it's easily treated. That's the nice thing about it, is that we just use antibiotics, and it does treat it, and hopefully most of the symptoms will go away. But that is the key to it. Now, like I say, you can go through and do some testing to confirm the diagnosis, but a lot of people will just go ahead and treat based on the signs and symptoms of the case. And as a result of that, I think sometimes we see some variation in the numbers. There were a couple of studies done by the CDC to see really about how many people a year get Lyme's disease, and the numbers fluctuate from somewhere around 250,000 to 300,000 people a year get Lyme disease. And those numbers are mostly concentrated in the Northeast.
Okay.
But they have been found pretty much over most of the country. In Georgia, for example, a few years back when this first came into the news, we saw the numbers go from single digits up to, I think the highest number we ever saw was around 30. But the last year that any reporting was located on the CDC website, I think the number was still back down in the single digits, somewhere around 8 or 9, something like that. So it does happen in Georgia. It's just not as common as maybe you might fear. And it's certainly not as common as it is in the Northeast.
And now, are they like the other ticks that they will get bite and kind of latch on and suck for a while, or okay?
That's basically how a tick works. It pretty much buries its head into the skin of its host. And of course, deer ticks do this mostly with deer, and they get the and they get the infection, and from that way, and then next thing you know, then they can pass it on to whoever they bite next.
So the deer is the primary host that has whatever this disease is first?
The deer do get infected, and sort of like the chicken or the egg, which one happens first? I'm not quite sure off the top of my head. But the bacterium is what causes the problem. The tick is just sort of the vector or what transmits it from one place to another.
Okay, because I knew with regular ticks, and most of the time you can, like you said, you'll ultimately find them when they get a little bit bigger. It sounds like the deer tick would be a little bit, maybe even as it's bigger, hard to find.
It is, and so basically what I suggest is that, if you've been in an area where these ticks are known to be, then I would suggest just being sure to check and make sure you don't have one that's already embedded in you when you step out. The way to remove a tick.
Yeah, I was going to ask you what's the best way to do that.
It's like, oh, gee, what do you do? We used to say, oh, you take a pair of pliers. That's what we did with dog ticks.
Yeah.
But when you squeeze on the abdomen of a tick, it tends to regurgitate the blood back into the person. Don't really want to do that because that's probably going to increase in the amount of bacteria that would be getting in there. So instead, what we normally do is we take something like a gel. You could use something like, I guess a dishwashing gel or something like that, and just put it on right at the site where the deer tick has embedded itself, and from it will then begin to suffocate. And so what it does then, it's going to come loose. It's going to detach, and then when it detaches, then you remove it and you take it off that way. If you just pull it off, usually the head will embed into the skin, and you don't really want that either.
Oh, well, as far as the site itself, once that, so if a deer tick was to bite you, you don't necessarily mean you'll get Lyme disease.
No, or any tick as far as that goes. And there's the bad downside of this is that there are other things that can be associated with ticks as well. Toluramia is another one, and Rocky Mountain spotted fever is another one.
That one's one I've heard of, Rocky Mountain.
Well, that one's more common in this area, but it's a rickettsial disease. It's another bacterium.
Okay.
But it's just simply that you do run the risk. And so anytime you have a tick that's embedded in you, I think it's best to make sure you get a hold of it as quickly as possible and try to get that thing to release and get it off of you.
Yeah, I would definitely. I don't want it to stay. I don't want it on there any longer.
No. And if you just find a tick crawling on you, that doesn't mean anything either. If it doesn't look like it's been feeding on you, then it's not an issue. The tick actually has to bite in bed and regurgitate some of its saliva to infect you.
But just so we're real clear, it's definitely not the same one that we typically see with the big fat ones on the dogs.
No. Very small.
And they're
small.
probably the most common in this area.
Yeah, they pretty much are. Yeah, and of course there's a lot entomologists out there can tell you that there's a lot of different kinds of ticks. Okay, just like there's a lot of different kinds of grasshoppers or something like that. But yeah, the dog tick, as most of us call them, that is not the one that's going to give you a problem. And
I guess I keep thinking of other things with the first talking about the ticks in general, but when we come back, when we take a break in a few minutes, I want to talk about how are there some things that can mask if it looks like it's Lyme disease and not, kind of get into that part of the discussion. But before we do move on to that, I want to talk about the ticks itself, because in Georgia, people say, "Oh, well, why are we worried about Lyme disease?" You say, "Not really worry about it," but ticks in general. The Rocky Mountain spotted fever, is that a specific tick?
I cannot, right off the top of my head, remember the species, genus and species. Those things were hard for me to pronounce anyway. I'm from Georgia.
We'll keep it simple.
In any event, yeah, those are more common in this area.
And
now,
do they look like the dog tick? Are they different? Are they?
They're a little bit, well, they're bigger than the deer tick.
Okay.
But they're not quite as big as the dog tick. So,
okay.
Yeah, so it's a little bit different. The thing about it is, you probably, the best way to think about this is to try to prevent any tick bites to begin with.
Yes, prevention.
So, yeah, prevention is the way to go. And to do that, you can use several different types of repellents if you are going to be going into an area where ticks are known to be. And if you have problems with your animals, say you have an inside dog and they go outside and they get a tick and they come back in, then you might want to treat some of the area around your home for ticks. I've heard it said that like Army Rangers and people like that, when they know they're going out into the field, that they will get a dog flea and tick collar and put it around their ankles to ward off any infestations while they're out there. So that's an idea too. I don't suggest wearing one all the time. Yeah. And if you're going to do that, at least I would think keep a sock or a boot between you and the collar.
Yeah.
But little measures like that can sometimes prevent bigger problems later on.
Yeah, and I know sometimes it's hard with the pesticides that we put on ourselves.
Yeah.
DEET, I think, is supposed to be a real common one in many of them, but then you could have someone that has a reaction to the DEET.
Right, and if DEET is excellent for mosquitoes too.
Yes.
And if when we start talking about some of the other things like chikungunya and all that sort of thing that came around, got into the news last year, we were talking about that. But again, the best measures to prevent mosquitoes is to get rid of the places where they breed.
Right.
And we've been having a lot of rain this year.
Yes, I've worried about that this year.
I think the mosquitoes are going to be a little bit more of a problem this year, especially in the southeast. And I just saw a report where they say that ticks actually are going to be more of a problem because we've had such a mild winter.
That's what I was going to ask,
Yeah.
if that really had a difference in if we had a cold enough winter or not with the...
It does make a difference. I think we're going to have more insects in general, but I think the number of ticks are going to be increased just simply because we didn't have enough cold weather to really, knock down some of the infestation.
Well, on a insect, but what about a regular bug, a cold bug? Is that true for colds too, that not having a hard winter can make that colds and flus?
Now, colds and things like that are a little different. They're viruses.
Okay.
And they usually aren't affected by such.
Okay.
Yeah.
Well, unfortunately, we have to take a break, get your
that's okay.
coffee, and we'll be right back with Dr. Reeves.
My college offers classes that meet my educational and career goals.
With opportunities outside of the classroom,
where the faculty know me by name.
My college can prepare me for my career.
I can earn an associate's degree and transfer credits to a bachelor's.
My college is a state college within the university system of Georgia.
My college offers courses that fit my schedule.
It's where excellence begins.
We are.
We are.
We are.
We are GHC, Georgia Highlands College.
Welcome back to GHC Coffee Break. Dr. Weaves, I may be a tick expert after this is all over with. Maybe all of us will. I don't know. Not my favorite critter, I guess, but you know.
Well, not mine.
Yeah.
No.
And to know that there's so many different kinds, I guess, until really the looking at some stuff on Lyme disease and realizing there's a lot of different. You know, I guess I grew up thinking a tick was a tick was a tick.
Tick was a tick. It's very much different. There's something that is probably hasn't gotten a lot of mention of late, but I'm about to tell you about it. It's something called the Southern Tick Associated Rash Illness, or STARI.
Oh.
It is a tick-borne illness as well. But it's not as severe as Lyme disease. But it does tend to mimic it a little bit, and that you get a tick bite, and this particular tick is called the Lone Star tick. And so it's very prevalent in the southeast and the south.
What's it look like?
It's a tick.
Okay.
But again, the difference is going to be in the size.
Okay.
Okay, this is more like a regular tick that you might find in this area. As I say, the tick for the deer tick is very, very small. It's a tiny tick. If you were to have a dime, for example, you could probably put 40 or 50 of them on a dime.
Oh, that is little.
So it's a tiny little tick. But the Lone Star tick is a little bit bigger, and it is more common in this area. And what happens is you'll have the tick bite, you'll see the tick bite, and you remove the tick, and then you come up with this rash that comes up around where the tick bite was. And you say, well, now that sounds a lot like Lyme's disease. It does, except the rash tends to get a little bit bigger, and it gets to about 3 inches in size.
Oh, wow.
It does not cause any of the chronic symptoms. It does not cause any of the neurological symptoms or anything like that normally the Lyme disease does. And so it seems to be sort of self-limited.
Okay. Go ahead.
Oh, I was just going to say that going back to Lyme's disease right quick, there, you know, I said you pretty much make the diagnosis and then you give the treatment for it. But there is something called post-Lyme disease symptoms, or a chronic kind of illness that goes along with it. And it's not really considered chronic because it lasts for about 4 to 6 weeks after you get treated. Okay. So it just sort of like your system is clearing everything out. So you may still have the myalgias, may still have the body aches, you know, that sort of type of I don't feel good kind of symptoms. But that should go away after about 4 to 6 weeks of adequate antibiotic treatment.
Okay. Well, are there some things that mimic Lyme disease or Lyme disease mimics that's not associated with the tick?
Right offhand, it's hard for me to think of anything, although the myalgias and body aches and pains and joint aches that can go along with a lot of different things. For example, bacterial illnesses or even viral illnesses. You know, when you're starting to get the cold or a fever or flu, you know, and you get the fever and you get all that whole body ache and pain kind of thing. Well, that's sort of the feelings that you get with the beginning of Lyme disease. Okay. Except, of course, with a cold or flu, you don't have a bite with a tick and a big ring, you know, sort of a bullseye ring around it. But it's your body's way of ramping up the immune system. When we do that, when we ramp up the immune system, your body does sort of fall into this something's going on kind of thing. And you get the overall aches and pains and fever and that kind of stuff. Well,
you know, that's the thing with medicine is, I tease, they call it practice medicine for a reason. Because sometimes our body is it's so unique to us. Even though we may have the same illness, it can be how we react to that illness can be very different.
Yeah, that's true. Everyone can react a little bit differently, and that's the fascinating part of medicine as far as I'm concerned. And you know, because if everybody reacted the same way to everything, you really wouldn't need a doctor. You just have a computer that would take care of it for you.
Yeah, that's scary.
But everyone is different, you
Right.
know, and you have to take all that into account. Now, just branching a little far off our topic this a little bit this morning, I think what we're headed toward in medicine is a new era where we will really be looking at personalized medicine. Personalized medicine will be able to, you'll go into your physician's office, they'll do what we call a buccal swab, just a little swab inside your mouth, and they'll run your DNA. And from that DNA, we're going to be able to tell what you're prone to get. We can do that already. We can also tell, in the future, we're going to be able to give you this kind of information because we're still gathering data now. But we're going to be able to tell you what medicines will work for you and what medicines won't.
Yeah, because that's true. Different medicines can definitely react different.
Well, that's why we have so many different kinds of, let's just say, for example, blood pressure medicine.
Mm-hmm.
Okay?
Oh, yeah.
We've got all sorts of kinds of blood pressure medicines, and not every one of them works the same on everybody.
Right.
So we could probably in the future then look at your DNA and say, well, you know, an ACE inhibitor will work to bring down your blood pressure, but a beta blocker is probably not going to be the best choice for you.
Okay.
And so we will be able to personalize medicine so much more.
Wow.
And I'd say the coming maybe 10 years.
Wow.
Because the technology is changing that rapidly. I was just recently at a meeting in Kansas City, and we had a specialist come in to talk about a new technique that they've invented and they're testing now, and it's called a vagal stimulator. He has found that, and this fellow works for in this research lab. I think it's the Feinstein Institute, if I remember right. He says that he has found through different types of experiments that the vagus nerve, and you have two of them that run down both sides from your brain down to the rest of your body, basically innervates every major organ in your body. It goes from your heart to your pancreas to your kidneys to, you know, basically everywhere. And they have found that if they alter the signals of the vagus nerve, they can reduce inflammation in the body.
Oh.
Yes. And this inflammation is what causes arthritis. It's what, and we're finding that it causes a lot of different things. He's already seen that this particular device that they have developed can reduce rheumatoid arthritis, which is one of the tougher ones.
Yeah,
that is so debilitating. And we're now seeing that it is works very well in things like irritable bowel syndrome and ulcerative colitis and this sort of thing. So his theory is that we'll be able to alter the signals that come through the vagus nerve that will then alter your body's response to just about anything. And so it may be that in the future, instead of taking a pill for something, we reprogram your vagal stimulator.
That sounds interesting. And it's like, okay, whatever.
Yeah. Yeah. The first one that he showed us, he showed it into, that they implanted it into a lady who had arthritis, was about the size of a pacemaker, and they implanted it where a pacemaker would go.
Oh, okay.
But he also passed around for all of us to see the latest version of it. It's about the size of a capsule. And it's got a little indentation in the back. And what they do is they implant that right next to the vagus nerve.
Wow.
And the vagus nerve has about 10,000 fibers that run through it. So it can actually program into those fibers which ones to turn on, which ones to turn off. And
ooh, makes me think of the sci-fi movies with nanobites and
yeah. And the way that little thing that's the size of a capsule has the battery and everything in it.
Oh.
And so to change or to adjust your dosage, shall we say, you put on a little collar, you go to your doctor's office, they will pick up their iPad, punch into it, and say, oh, okay, well, that's not working so well. Well, we'll just increase this, do that.
Oh.
Yeah.
I'm trying not to be a non-progressive and go, oh. But at the same time, it's like, that's almost scary. It's Terminator style stuff.
Well, I tell you, after
iRobot.
Yeah, after his presentation, I was like, give me one. I'm ready for it. Yeah, because it sounds like it is the non-chemical way.
Well, yeah,
of
I'm
dealing with all
really
this
tired
stuff.
of the chemicals.
Yeah, you know, it's everything has side effects, but so far he hasn't found anybody that has any kind of side effect to this.
Well, that's really
new technology.
interesting.
Well, because signals go through your vagus nerve all the time.
Makes sense.
You're just altering them.
Well, real quick, I want to go back to just one differentiating between a bacterial and a virus, since we've been talking about the fleas or the ticks. Excuse me.
Yeah.
And I know fleas probably got their own things that it can cause. We won't even go down that road.
Well,
but what's the difference between a virus and a bacteria?
All right. A virus is just think of it this way. A bacterium is a living organism, okay? It has DNA in it. It in most cases can move. It can replicate itself and then go on to make more of itself, basically. Okay, that's a virus. I mean, that's a bacteria.
Okay.
A virus can be DNA or RNA, and a lot of times it's just an RNA bit of genetic code.
Okay.
And that virus then by itself can't necessarily replicate itself.
Okay.
It has to infect something else to replicate it. So what a virus does is it will infect a cell in your body.
Mm-hmm.
It will then hijack that cell to make more of the virus.
Okay.
And so, you know, you make proteins and enzymes and all that sort of stuff out of your cells all the time. Well, this virus gets in there, plugs itself into the whole replicating process and sort of hijacks it and makes more and more and more of the virus. So when you have a cold, you've got this virus replicating itself and your body is trying to fight it off. And when it tries to fight it off, it creates more mucus and that sort of thing. And that's why you cough, is because that mucus gets all in there, trying to set up a barrier so you can get that thing out of there. And viruses, until the whole AIDS epidemic occurred, we really didn't have anything to fight a virus with.
Right. I've always heard, you know, if you've got a cold, you just let it run its course.
Right.
Pretty much.
Yeah,
Flu is different or something else. You know, there's a lot of things that make a difference between if it's a virus or a bacteria.
Right.
Because antibiotics
won't treat a virus.
Right.
They will not. You know, we have the saying in medicine, if you can treat a cold and it go away in about 7 days, and if you don't treat it, it takes about a week. So
that reminds me of Granny Clampett. I don't know if you ever saw that. You know, she used to make that medicine and said she had the cure for a cold, but it was basically 7 days.
Granny had cures for a lot of things.
Oh, yeah. We're showing our age now, aren't we?
Aren't we?
Oh,
yeah.
Well, get your coffee and we'll be right back.
The average text takes your eyes off the road for nearly 5 seconds.
Welcome back to GHC Coffee Break. I am so excited that you came. I was saying during our break that, you know, we batter off of each other. We should be the new Kathy Lee and Michael Strahan. Or actually, I think it's, what's his name? Yeah. Ryan Seacrest's now.
Oh, that's right. He did take over, didn't he? I know Ryan Seacrest.
Well, obviously no Kathy Lee either, so we won't go there. But I really enjoyed having you on the show. Hopefully we can get you back. I really like the health awareness. Maybe we can make it more of a regular thing again once our lives get a little bit better. Or less stressful. I don't know.
I don't know.
Doc,
Yeah. We'll try.
Yeah.
Okay.
So until next time, GHC Coffee Break. We'll see you next time.